My name is Dr. Stephen Maislos. I'm a urologist based out of Houston. I've been in practice for about 21 years now. I did my training in New York and my fellowship in robotic and minimally invasive surgery in Texas, and subsequently started in private practice in Houston about 21 years ago. The effects of overactive bladder can range from urinary frequency, urgency, and urgent incontinence. In its most extreme variety of urgent incontinence, these patients oftentimes wear dark clothing to mask any accidents they anticipate happening. Other patients, as soon as they walk into a building or a movie theater, immediately figure out where the bathrooms are. Therefore, these symptoms really are life-altering and change how they approach their day-to-day. Overactive bladder is a highly prevalent condition which is underdiagnosed in most communities. This can be because patients think that it's part of a normal aging process and therefore don't complain. It can also be a function of physicians not asking about it. I think it behooves us as physicians to ask about it because it truly affects a lot of patients' lives, and patients often suffer in silence. Diagnosing overactive bladder in men who have BPH is an important part of our jobs as physicians. Many men in the past had their BPH treated, but never had their residual irritative voiding symptoms addressed subsequently. Things that I use often to help discern what's happening is with the patient is the AUA symptom score. 24-hour voiding diary has proven very useful. In addition, I use uroflows and PVRs, and if needed, urodynamics. I always explain to my patients, you have the pump and you have the pipe. The pump being the bladder, pushing the urine through, and the pipe being the urethra and the prostatic urethra, which you want to ensure is not obstructed. To really be complete, I think it's not enough just to treat the BPH, but to really address the irritative voiding symptoms that may exist after the BPH is treated. I prescribe GEMTESA to a wide variety of patients in my practice. I've found it to be efficacious in both genders as well as in a wide range of ages. I haven't found any problems with polypharmacy in older patients, nor have I found it to be difficult to dose, since it comes in one dosage. It's crushable and easy to take. It can be taken with applesauce. So I find that it really has been a useful medication for numerous patients in my practice. Prescribing GEMTESA, a beta-3 agonist, for my patients with overactive bladder, male and female, has really made a difference in addressing their symptomatology. The efficacy of the GEMTESA is something that the patients notice.
Indications and usage. GEMTESA is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. GEMTESA is contraindicated in patients with known hypersensitivity to vibegron or any components of GEMTESA. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking GEMTESA. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue GEMTESA in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with GEMTESA. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue GEMTESA and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with GEMTESA were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see full prescribing information.